at Rose Medical Center, so they're going to give us a talk today. Dr. Mueller is going to talk to us about some alternative and naturopathic acupuncture therapies, I think mainly geared towards cancer patients, but also for other entities also. So Dr. Diane Mueller, she went to undergrad at Southwest Missouri State, and then she's got a couple certifications in natural medicine. She's got a master's of acupuncture and also a doctorate in natural medicine. And she's worked at a couple places. One at Progressive Health Center, which has a location here at Rose.
And at Swedish.
And also at Swedish. And also in a private practice over called White Willow Healing Arts Center, which is over in Centennial. So thank you very much for speaking to us.
Hi everybody, can you hear me okay? Great. So I'm Dr. Diane Mueller, thank you so much for coming. I want to start by just going over a little bit about what naturopathic medicine actually is, because a lot of us do not know. So how many people are actually familiar with what naturopathic medicine is? A few of us? Okay. So basically what this is, I'll go over my education real quickly and then we'll get into the actual talk today. What naturopathic medicine is a 4-year degree. It's a 4-year clinical doctorate. And these are the areas of how our profession, of how our education is similar to a Western physician. So what you're looking at in the black here is the University of Washington. And then underneath it in the blue here is going to be Bastyr University, which is one of the 5 accredited naturopathic schools in this country. So you can see that our education is actually very in alignment with each other as far as looking at where the classes that we're focused on. So really in the grand scheme of things, what this does is it allows us to, I think, use a lot of the same language and be able to kind of talk to each other in a very professional medical way. I bring this up because one thing that has happened where I think a lot of people have gotten scared or just haven't really known who to send to people like me is really in the area of what is this training? For a long time, Colorado and several other states did not have any sort of real licensing as far as naturopathic doctors were concerned. And so what this meant is that people could say, go and take a few classes online, get an online certification, and call themselves a naturopathic doctor, which really is a problem for a lot of people. It's a problem for you guys, it's a problem for us, it's certainly a problem for all of our patients in that nobody knows exactly who to trust, who has had training, and who is not. But it's a very exciting time for our profession in that we just had a law pass in Colorado the 1st of January, which basically allowed us to have this title, naturopathic doctor, protected, where unless you've gone to a 4-year clinical doctorate accredited program, taken board exams, gone through rotations, you cannot use this title. So it's very exciting for us and good for you guys to know that if people are using this title in Colorado, it now means that they've had training similar to me. So we're going to mainly talk about cancer today, but these things can be, these herbs, these supplements, what we're using can be used in a lot of different places. And, you know, I want to start, too, by kind of grounding what we're doing here and that, you know, the purpose of all of this, of all of us coming together today, of the patient care that you guys do, the patient care that I do, really is grounded in the same purpose. And that is for all of us probably a deep love and a deep care for people and for helping people and for helping people move through really hard things in their lives. And I bring this up because I think it's important as we talk through this today that we're really focusing on the intentionality behind it all, and that's medicine, in my standpoint, medicine from the naturopathic standpoint, used to be focused. We used to use the word alternative a lot, And I want to really emphasize that what we're doing in an integrative care model, that what our goal is not to be an alternative, but really to be a complement. And as we go through these different therapies, I encourage you guys to ask questions, and I really want you guys to kind of think about ways that we can be utilizing our medicines to work together, because it really can add so much to our patient care if we can kind of get on the same story and the same page here. So let's talk about some traditional things, or some things that we'll see come up in cancer treatments for people. And this lecture was, the focus of this lecture is on breast cancer, but this can be applied across the board. So a lot of the studies are going to be looking at breast cancer patients and looking at different therapies for breast cancer. So one of the side effects that can happen from drugs that we use for breast cancer patients is clotting. So what do we do naturopathically for clotting? One of the things that works really well for us is nattokinase. And nattokinase is an enzyme. This study that we're looking at basically divided people into 3 groups: into a healthy group, into a cardiovascular disease group, and to a group that was undergoing dialysis. And we basically gave this amount of nattokinase, 2,000 fibrolysis units a day, and we saw what would happen among these 3 groups. And so we did this by measuring these different clotting factors, so these different fibrinogen, factor 7, and factor 8. And we looked at these 3 groups here to see, okay, how they were affected based upon these clotting factors. And what we found with nattokinase is in all 3 groups, we did have a decrease in these clotting factors, showing the ability of nattokinase to work for treating the side effect of clots. So dosing, as we know from pharmacological medicine, is always very important, and the same goes for naturopathic medicine as well. It's really, really important that if we are using something that is a protease, that is an enzyme that's breaking down a protein, as we see here, that we are dosing it away from food. Because as a protease, if we dose it with food, it's going to basically break down the protein. And it's not going to turn around and break down these clots. So the one place where we really need to be careful about this is actually with anticoagulant drugs. Because of course, they will decrease the fibrinogen and these other factors, we are going to be worried about it actually interfering with some of these anticoagulants. Any questions on that?
Why is this better than Coumadin?
Well, it's more of just looking at other ways that we can get people on herbs that don't have as many side effects, is really what we're looking to do here.
It doesn't work at a deep enough level.
So the question was, why does this work? Why would we use this instead of Coumadin? And certainly, it's a really great question. And certainly, if somebody, it depends really what we're looking at is how severe these levels are. If we're using this as just a mild preventative for some side effects of estrogen.
What if they have atrial fib?
Then this might not, if they have something like atrial fib,
When used,
this might not be the time to use it.
can you write a prescription for it?
It doesn't need a prescription.
Oh, really?
No.
What's it called?
So this is called nattokinase. So it's spelled like this.
And you
Yeah.
go to one of these health stores and buy it.
Well, so here's the thing, and I'm really glad you're bringing this up. So the question was, can you go to a health store and buy nattokinase? And you certainly can. One of the issues where people in the industry, I think for all of us, typically have a huge problem with some of this natural stuff is the unregulation of these medicines. And the problem can be if we go to certain health food stores and just pick up one nattokinase, it can be dramatically different than another nattokinase. And that can be very scary, right?
Yes,
It is, and I know this is a concern that has been brought up. So basically, there's a few brands where there's a lot of research and development about, and where studies like this will use particular brands, and those brands are stronger There's more research behind them, and therefore they're typically more expensive because there's more R&D with them. And those brands are only available to physicians, where because of their strength, because of these sorts of things, because of the control, these companies will only sell to licensed physicians in order to make sure that people that are taking them are under the care of a provider. Yes?
A couple things. It sounds like it's not dialyzable since some of the people are on dialysis. And the second thing is, do you have to follow clotting? Do you have to follow bleeding into people on nattokinase bleeding?
I mean, it's certainly like anything that, if we are worried about a bleeding and a thinning of the blood, and, we are going to be concerned about the same sort of things as we would say like a Coumadin, for sure. But also, as was discussed, it's like it is not going to be as strong as something like Coumadin, but certainly it's a really good thing to measure and to make sure, because it absolutely will change clotting time and therefore bleeding capabilities and ability.
Is it measured by an IR?
Absolutely. Yeah, that's exactly how I would track this, is with the IRN or INR.
INRs.
Yeah. Other questions? So, other things we can do with clots. So, ginkgo. Ginkgo is an herb. Ginkgo biloba is its full name. And so this study is basically looking at a few things. It's looking at ginkgo with circulation, ginkgo as an antioxidant, and really a lot of this is looking at ginkgo's ability to improve mental function. And so it's used for mental issues and for cognition health because of its effect on the vascular system. And what they saw, this study on rats, was looking at edema of the white matter after they administered this tritheltin toxin. And what they found was that after 7 days of a ginkgo, the phosphodiesterase activity, which is what they were using to measure the effect of this toxin, was increased. So basically this toxin decreases phosphodiesterase activity, and then with the ginkgo, that reversed that issue, reversed that effect. We also have studies that's showing that ginkgo is responsible for platelet activating factor antagonism. So it's going to affect clotting through the antagonistic method. And then this study, I think, is my favorite one that I have found, of looking at fibrinolysis of a clot between comparing streptokinase and ginkgo. And what that study found is that there was actually no comparable difference to the ability of these two things to basically dissolve this clot. That they worked in a very similar mechanism, and they had the same effect.
Can I
Yeah.
ask a question going back to the nattokinase again?
Please.
Is there a way to reverse it, or how long does it take for it to get out of one's system? And if a person bleeds, is there something that reverses it?
That would reverse the nattokinase. I don't know of, say, like an antidote to it.
How long would a person continue to bleed if they bled on it, they had an overdose of it, they bled on it, if they injured themselves? When would it stop?
That's a really, really great question. I'm not entirely positive of the exact answer to that question. I'm sorry, what's that? Well, I mean, this is what the study is showing us, as far as
7 and 8.
You can measure these factors.
Right.
Factors are measurable.
right. And so this is basically what we're saying at this sort of dosage, 2,000 fibrolysis units a day. This is the effects we're seeing on these clotting factors. Is this percentage a decrease in the clotting factors? So really what we're looking at is, in the grand scheme of things, we are not going to have to worry about, say, bleeding near as much as with something like this as something like a Coumadin.
It's just as good as baby aspirin. It doesn't bleed.
Right. It will change. I mean, it will change clotting factors for sure, so it's something we want to consider. You know, if somebody's going into, say, a surgery and we're worried about blood thinners, we're worried about, you know, things that are going to make them bleed and not be able to clot, I would certainly get them off a nattokinase.
Well, say, Coumadin is reversible by vitamin K. And the other, the low molecular weight heparins are not reversible.
Right.
And they have to go 48 hours, so I wondered where.
No, it's a great question, and I don't know for sure that that's been something that's studied. I mean, I think the interesting study would be to look at something like vitamin K, since we know vitamins K's effect on these clotting factors. So I think that would be a very interesting study. I don't know if that's been looked at though. Other questions?
If you use an anticoagulant, it's something like 4% of people will have trouble with clotting.
Yes.
If you use the aspirin, say, then about 2%, half of that. So you don't know where this, does this fall in the 2%?
I don't know where that falls. Nope. Nope. Okay. So since we're talking about cancer, basically in early stages of cancer and post-chemo treatments, when we use some of these estrogen antagonists and aromatase inhibitors, my question was, what does ginkgo do to them? Does that change? Because this is when we're going to really use ginkgo in cancer treatment. And this study basically looked at ginkgo and combining it with people that were on these drugs, and basically was found no difference in the amount of the hormones, or I'm sorry, the amount of the drugs and the metabolism of the drugs in our system. So basically saying that we can take this and it's going to safely not interfere with the actions of these particular drugs. So, you know, in the grand scheme of how we can use this with our patients, if somebody, say, does have high risk of having clots and maybe family history of stroke and cardiovascular disease, that might be a time to use drugs like Coumadin after we do some of these lab testings and we see where some of these labs, some of these clotting factors and the INR turn out to be. But that being said, if we don't see that cardiovascular history, this can be a supportive thing to use if we just want to mitigate some of the potential risk of drugs, of some of these drugs. Is that making sense? Okay. So other things we can consider are magnesium and arginine. And so magnesium and arginine, most studies done on magnesium and arginine are actually done on IV forms of magnesium. So this is something we want to consider to use as something to help with clots, and it mainly is going to work by a vasodilation effect. Magnesium is actually going to affect the NMDA calcium glutamate channels, and so they're going to block calcium's ability to make the vascular contract and thus raise the blood pressure. Arginine is a precursor to nitric oxide in our body, and nitric oxide is a vasodilator. It's going to make our vessels also relax. And so through those mechanisms, we're basically changing the pressure of the blood, and therefore can influence clots. The big issue, like I said, is the exact dosing of what we do this, orally to get this effect is still not been well researched, but we do know IV dosing is what's really looking at this, and so that's an opportunity for us. If we do take it orally, the biggest side effect, there's two things we need to worry about calcium dosing in general, especially from an oral standpoint. One is that it's absorbed at the same time through the same receptors in the gastrointestinal tract as calcium. So if we take a lot of magnesium, we need to take calcium as well, otherwise we can block calcium's absorption. So that's really important. And the other thing is because of the amount of basically osmosis, because of the amount of particles that we're actually putting into the system, into the digestive tract at one time, it can cause osmotic diarrhea. So you can really get some loose stools with it. So, and that can be one of the reasons why most of the studies are looking at the IV administration, because with IV we can get the dose a lot higher for people because we don't have to worry about this osmotic diarrhea occurring. So, and then we have other studies that are basically, and these are just correlation studies, but they are correlating magnesium deficiency to atherosclerosis, to hypertension, to different chronic diseases, and cancer. That's just arginine. So let me grab my little notes that I left down here real fast, so I don't have everything on here. So here's an issue that I have talked to, especially in the oncology world, I've talked to several oncologists about this, is that we really have to be careful in doing anything that's going to upregulate the liver when people are on other drugs, is we don't want to make these detox pathways necessarily go too fast or too slow, or change them mid-treatment, because we don't know how that's going to change the dosing. So it's been one of my greatest areas of focus and challenge is basically finding ways we can support the liver and help the liver detox from these drugs. And especially in a world where, a lot of people's livers are detoxing slower because of all the toxins in this world, because of all the pesticides, because of all these environmental things that we didn't used to have. We're asking our livers to do a lot more. And so as a naturopathic doctor, one of my goals is to really look and say, how can we make the liver work better, but how can we do it in a way that's safe when you guys as prescribers have people on different medicines. And this is, I think, a really important topic. And so the way that I've basically done this is through helping our body detox just with foods that are just things that people will eat every day, that's just going to basically help the liver detox in a normal, natural way that it's supposed to, just through diet, but not by giving people tons of supplements. That's where we're concerned that it's really going to mobilize things and toxins through the liver too quickly. So the biggest thing that artichokes are going to do is artichokes are going to help with the production of bile. And this is really important because if you guys recall from physiology, when toxins go through phase 1 and phase 2 detoxification processes, the liver then puts those into the bile, and then the bile, of course, goes into the intestines and gets out of our body through our stool. And so by basically creating more bile, by allowing people to move toxins better, they are able to get some of these things out of their body in a safe way. The next thing is through beets. And beets have a couple of different things, and one thing that beets have is betaine. And betaine has a few different uses. One thing that it decreases the activity of the methyltransferase in the MCV breast cancer gene. So there's actually research of using a betaine from beets as helping with the gene expression in breast cancer. So another thing that beets will do, along with another component called volgaxanthin, is it's going to help increase phase 2 detoxification in the liver. Why is this important? So if you guys recall, phase 1, what phase 1 is doing is phase 1 is basically is doing the first part of getting these drugs, these chemicals, these environmental toxins out of our body. Phase 1 in the liver is basically changing things so they are a different chemical composition. But that composition, they are not soluble in water and therefore not soluble in the blood. So we can't actually excrete them from our body. So then what phase 2 is doing is it's basically allowing those conjugates. There's different enzymes that are working on the phase 1, and they conjugate those toxins, and they allow those toxins to therefore move from our liver into our bile to leave our body. So it's really important when we're considering detoxification and we're considering, wow, do our patients, do our clients get sick from some of these things we're putting them on, that phase 2, phase 1, and phase 2 are working appropriately together. Because what will happen is if phase 1, which is starting to mobilize the toxins and get them, say, into our system a little bit more, if they've been stored in our fat, where toxins are stored, phase 1 will mobilize them, but it's not going to get them out of our body until phase 2. These enzymes come along and influence and change these molecules. So if we have somebody that is in a situation where their phase 1 is not working as well, their phase 2 is not working as well, and phase 1 is working just fine, then all these toxins, all these chemicals that can be running around our body from drugs, from environment, from other places that we have these molecules inside of us, are not going to be able to be excreted. So that's why making sure phase 2 is working appropriately when we are giving people, I mean, just really when we're living, when we're out in the world, when we're eating, when we're coming across exhaust from trucks, whatever toxin it may be. But that's why it's really, really important. And here's where beets come in so handy, is because it's a way that we can just give the body the fuel that it needs to make sure that it is regulating these things well. Does that make sense?
Yeah, good. Finally got something.
You're happy you're here now, huh?
Yeah.
Oh, good. I'm happy you're here too. Okay, so then parsnips. So parsnips are part of upregulating the phase 1 pathway. So this is something that we have to consider. And this is also an interesting place to bring up the whole idea of the MTHFR genotype. How many of us know about the MTHFR genotype? A few? So the MTHFR genotype is basically a genetic, it's a genetic polymorphism. So it's basically a SNP that has caused folate from being unable to basically convert to its active form. Okay? So when we intake folic acid from food, we can't actually utilize it. We actually have an enzyme, methotetrahydrofolate reductase, that's going to basically take that folate and it's going to make it active so that we can utilize it. The reason this is so important in this conversation is because it's folic acid that is driving so many areas of liver detoxification and absolutely drives phase 1. So the studies I'm looking at, the latest study I looked on this show that I looked at basically a lab analysis of what was ARUB labs, and they're looking at how many people that they're testing for this genotype and are finding people come up as positive for this genetic polymorphism. And in the Caucasian, they looked at 2 populations, African Americans and Caucasians. In the Caucasian population, they were finding 33% of Caucasian people had this genetic polymorphism. That is high. African American population was only 1.4. So it's really something that we need to be considering when we are putting people on certain drugs. Is like, especially if people are having reactions to it, is do we have possibly a situation where there is a genetic polymorphism where the phase 1 is not working very well and things get backed up in the liver system. And so parsnips is something that's going to help work on phase 1, but of course this is not going to work if we have that genetic polymorphism and we don't fix it. And what do? We find this SNP. What do we do then? We give them the active form of folate, which is 5-methotetrahydrofolate, abbreviated 5-MTHF. And so for somebody that comes up with this genetic polymorphism, this is probably something that we're going to want to have them on for life, because we want their liver detoxing correctly. Very, very, very important. I can tell you in my private practice, I don't test everybody for this, but in people I suspect, due to different conditions, I mean, sometimes as simple as things like migraines, are they not detoxifying and they're getting headaches from it, which I see. I'm batting about 70% is what of people I test for that come up with this genetic polymorphism. Yes?
What's the cost of the testing, and does insurance cover it?
So the question is, what's the cost of the testing and does insurance cover it? And the cost of the testing, I believe through LabCorp, I believe it's around $150 out of pocket. It's somewhere right in that ballpark. And I'm finding that a lot of insurance will cover it. I mean, it's of course depending on insurance, but I'm having pretty decent luck with getting insurance to cover it. because it is becoming an increasingly looked at thing in the medical profession. And in the world of genetics and epigenetics, where we're really studying where people are, what their genotypes are doing for us, or doing for them and for their health, this is one of the areas where we're seeing people's health be affected the most. So another thing to consider is lemon. And basically these links I have here are to studies that are, that are showing some of the things that I'm talking about. So lemon is basically going to also help with the MC7-3 breast cancer gene. And basically what it has found in people with that gene, it actually is going to increase apoptosis for people with breast cancer. And then watercress and cruciferous veggies meaning broccoli, cauliflower, all of these in this family. Those things also are going to help phase 2 of detoxification work better. The other thing I really want to mention here in this food section is soy. Because I think soy, especially with breast cancer, has gotten a huge amount of press and publicity for quite some time. And so the latest thing, and even getting on Susan G. Komen's website, the latest thing that we're finding in the industry is that from a research perspective, we're seeing things kind of on both sides. I mean, we're seeing some research that is supportive of, yes, this phytoestrogen in soy can potentiate something like an estrogen-sensitive breast cancer. But then we're also finding research that says completely the opposite. So where I'm at with soy right now, and I bring this up because it is a hot topic, is it's a highly genetically modified food. So from that standpoint, from a GMO standpoint, it's been ripped of a lot of things like enzymes that are in food that help us break it down, making it harder for our bodies to digest. So it's not really a good food anyways. I do find a lot of people, when I test them for allergies, I do find a lot of people are allergic to soy. And if it's not that healthy, and it does have a lot of allergies in it, and really I don't think it's in the grand scheme of things very nutritious for it, and it has the potential to do this, and we're unsure about it, let's just get people off soy. So it's kind of one of those things, research says both ways, and I think that's an important thing to realize is there are both sides of this, but there's a lot of other foods out there that are so much more nutritious and so much less inflammatory that we might as well get people off soy. So, nausea. So something that we see for sure in cancer treatment, but also something we see for a lot of other causes too. So from a cancer perspective, we know that acupuncture can help with chemo-related nausea. And then we know electroacupuncture has been shown to help with chemo-related vomiting. What is electroacupuncture? Anybody know? What's that?
I was just guessing.
So I think you said something about pulses. So yeah, you're basically attaching, you have a physiotherapy type of machine, so it's similar to like a TENS unit. And you just basically have wires that are running from the TENS unit to these tiny little alligator clips. And you hook the alligator clips to the needles, and you'll run current through this. And this has been shown, clinically, absolutely, and then also in the research to help with
Where do you stick the
vomiting.
needles?
It depends on the diagnosis.
No, with nausea, where do you stick the needle? In the
So
stomach?
that
Here?
you
Where?
so how acupuncture works. I'm glad you bring this up. So acupuncture is a very, very interesting diagnostic method. And we basically as acupuncturists are diagnosing on the pulse. So actually taking somebody's pulse. But we're not looking at the same thing from, say, a conventional diagnostic perspective. Like in conventional diagnosis, we take somebody's pulse and we're looking for quantity, right? We're looking for beats per minute. Okay? In acupuncture, that absolutely is important. It's something that we look at, but we also are looking at quality. We're looking at what does that pulse feel like. And so a lot of what we do in acupuncture school, and a lot of what we do as we go through this clinical training, is we learn how to distinct these subtle variances in the pulse. And for some people, say nausea could come from a actual stomach-related issue. For other people, it could happen because of, say, a liver-related issue. And because of these micro changes that we feel in the quality of the pulse, I'm able to say, look at where I should put the needles. And so it's going to depend person to person. Now, most studies, when they're actually looking at studies for these sort of things, most studies on nausea are looking at a very classic acupuncture point called stomach 36, which is basically here. They're very, very tiny needles. Very, very tiny needles.
No, it's just below the knee. It's hard to connect with the stomach and the physiological reflex.
If you look at how the acupuncture channels flow, it absolutely does connect with the stomach. And we're looking at basically these microcurrents of lines and nerves. And it's interesting. I was at a continuing education event all weekend long for acupuncture, and the focus was on acupuncture and research. And what we're actually seeing now in research is how do we put a needle in here? And how does it affect here? And we're actually seeing changes in the research to a lot of the endorphins, to a lot of the neurotransmitters. So we're seeing changes in acetylcholine, we're seeing changes in GABA, we're seeing changes in dopamine, and these sorts of things. So through the mechanism of how these neurotransmitters, through the mechanism of how acetylcholine is going to cause a neural impulse to happen, we can start to understand why, if I put a needle here, we can actually see changes in some of this nausea and vomiting. Yes?
Do you have to actually use a needle, or can you use pressure?
The studies are done on needles, but clinically I do find pressure work does a really great job for people. And it's one thing that I do teach people is because my goal as a clinician is basically to send people home with as many tools as possible so they can go home, and if 3 hours later they seem to be having a problem, they have a tool to help. And so research-wise, I haven't seen studies like that work on pressure. Doesn't mean they don't exist. Clinically-wise, I absolutely do see great value in some of those tools.
Auto-suggestion.
What's that? Auto-suggestion?
Yeah.
I mean, placebo can be an amazing thing too,
That's right.
for sure. Yep, I'm perfectly comfortable with that if it works. So other things that we have to consider for nausea, for people of any situation, whether it's a cancer situation, whether they're on drugs, whether it's just somebody that's come into our office and say, hey doc, I have nausea, help me. It's just what they're eating. And some people from a functional medicine perspective, it can be just as simple as their pancreas is not working as well and their digestive enzyme process goes down. And we can test for this. One of the greatest ways to test for this is actually in a stool culture. As we can look and see, okay, well, there's supposed to be a certain amount of pancreatic enzymes that still are in our stool, and are they there? And so a full stool culture is called a comprehensive data stool analysis, where it's looking for more than just bacteria and parasites and some of these things that we typically look for. It's looking for more some of these functional things as well, as like, are people missing the ability to digest? Do people have nausea because they don't have the pancreatic enzyme output? And so food is sitting there in their stomach, in their intestines, for too long. I mean, with pancreatic enzyme, it's going to be more affecting their intestinal tract, but it can still lead to a lot of nausea just by the food sitting there. So another thing to consider, and why I write simple foods up here is it's just that a lot of times people in our diet we're really consuming these very, very complex meals. And our body needs our stomach needs different pHs to digest things. Protein needs a very, very, very acidic stomach content. We need a lot of the hydrochloric acid to be secreted. Things like fruits and carbohydrates aren't going to take the same amount of acid to digest. So sometimes it can be a simple thing, and these are great for like people that come in and it's like the IBS case, right? That it's like, okay, well, we've ruled out all inflammatory bowel diseases. We've done a colonoscopy, we've done an endoscopy. Everything is looking normal from all the diagnostic standpoints. Is it a basic functioning issue of just combining foods that can't be broken down in the way we're combining? And this is very simple, but it can also be a great help when we're running into these clients and these patients where we have done all the diagnostic workup and they they're telling us that they don't feel well, and and we believe them, but we can't find it, and sometimes it really is as simple as this. So other things that we hear a lot about are ginger and peppermint. And so there are studies out here that are showing that ginger does actually work with nausea, and particularly chemo-related nausea. We're also seeing peppermint, especially in nausea-related surgery, as being very beneficial. And I bring up this whole peppermint with GERD thing because this is a very important thing for us to know, is that the lower esophageal sphincter that's going to connect the esophagus to the stomach, that sphincter will relax when we take peppermint. And of course, if that sphincter is relaxed and more dilated, the chance of stomach acid, of hydrochloric acid, coming from our stomach up into our esophagus goes up. So it's really important that if we're giving peppermint, this is the side effect that we do want to warn people about and look for. And I certainly give plenty of people peppermint and see great results without seeing this, but it is something that we do want to be aware of.
How do you give them peppermint?
Absolutely.
How do you?
Oh, how? Like you said, how? So the question was, how do I give peppermint? So what's that?
Peppermint patties?
Not peppermint patties. That would be a very bad naturopath of me. So it works great as just essential oil if you get really, really good quality essential oil. So it's like anything, the quality matters. It also works awesome just as a tea. I mean, most tea tastes great. Peppermint tea is really very inexpensive, even for good quality stuff. So it's a really great way of having people drink something that's nourishing, that's warming, these sorts of things, and also very cost effective. Okay, so throat pain. So licorice is a COX inhibitor. So that's kind of cool. So licorice basically will decrease sore throat. It really has a propensity to go to the throat. So when we gargle with it, it can be very, very helpful. And in patients where we are having a lot of throat pain, licorice is a very, very good tool. We have to be careful with licorice because if it's regular licorice, and when I say regular licorice, I'm still talking about the herb, not the candy. But when it's regular licorice, we have to be very, very careful that we are watching our blood pressure because licorice can cause hypertension. And it's one of those things, the amount is really going to vary, and I put people on licorice and haven't seen a change in blood pressure. For people with things like orthostatic hypotension, it can be a great herb for them because it can help do that. But if you get something called DGL, which is when they take the glycerin molecule out of the licorice, it no longer raises blood pressure. So it's that molecule within the licorice which is actually associated with the blood pressure increase.
How about potassium?
So as far as for lowering blood pressure?
From licorice. Potassium is effective.
The potassium, do you know if it's effective? Have you read that somewhere? I don't know about that one. So what have you read?
Well, it can change the concentration of potassium in your body.
Okay.
Yeah.
So that's a good one for us to know too. So potassium can change the concentration of licorice in our body.
You know,
So,
a lot of candy that's licorice isn't really licorice.
well, and that's why I made that point, like not the candy. So it's very, very important that we're not sending people out to get licorice candy, that we're actually giving them the whole herb of licorice, or licorice in like a tincture or an extract, which basically is when companies will go through a process of extracting all the medical constituents of the herb into a water or alcohol, or what's called a dual extract, of when it's both water and alcohol. So difficult urination, equisetum, also known as horsetail. This one is a non-potassium sparing diuretic, and this one's going to work at a decent ratio for herbal medicine. It's 30% is what we show increases in urination. We also see it has hepatotoxic or hepatoprotective effect, and also an effect on leukemia cells. So with this one, vitamin-wise, it's thiamine we have to worry about. So we just want to make sure that if we are going to have people on long-term equisetum, that we are supplementing with the thiamine and at least watching thiamine levels. We also want to be careful as far as this herb and blood sugar. So really watching with diabetics, also watching with tobacco patients, people that are trying to quit tobacco or have a history of tobacco use, because it does have nicotinic effects. So other things that support the kidneys, eupatorium is an herb that helps with dysuria. Zeamase helps with tonifying the urinary tract. And then dandelion greens, from a food perspective, is one of my favorite kidney foods because we do see a diuretic effect, and we do see a potassium loss. What they have found is the amount of potassium lost in the dandelion, or lost because of the dandelion use, is actually replenished in the body because of the amount of potassium in the green. And I'm talking about the greens, not the flowers. So all these things that we kill as weeds in the dandelion world are actually really, really good for our kidneys. And the dandelion root itself is really good for our liver. So there's food out there. So
You didn't say anything about eggplant and what else was there? Eggplant and cabbage?
yeah, so basically eggplant and cabbage are just other beans. All of these sorts of things are basically other areas where they're kidney supporters. They are diuretics. I haven't done the research yet on these as far as if they are potassium sparing or not, but they will affect the kidneys in a diuretic way. So pruritus, another issue that of course can come up with cancer treatment. And so basic topical things that are safe to use are coconut oil, vitamin E oil, calendula. Calendula is an herb that is one of my favorite herbs in all of herbal medicine. It works it's a huge antimicrobial for us. And I've seen it work amazing on cuts and topical things as far as healing. So we're also going to consider with any sort of itching that there's a food allergy perspective or a food allergy component that needs to be looked at. Zinc has been shown to help with pruritus. Now here's another issue like with the calcium magnesium component that is really, really important that if we give somebody zinc, we also give somebody what? Anybody have any ideas? Copper. So zinc and copper actually competitively, they compete in our digestive tract. So basically they have the same receptors for absorption. And it's about a 10-to-1 ratio that I want somebody on. So if I'm going to stick somebody on 60 milligrams of zinc, I want to put them on about 6 milligrams of copper. Otherwise, I can cause a copper deficiency.
But you're not talking about local, you're talking about it taking.
I'm talking about.
What about something like zinc oxide ointment? Does that help itching? Okay.
You know, I don't know if zinc oxide helps itching. I know it's great for preventing sunburns, and that's certainly one of the most natural, non-invasive, non-chemical things we can use for sunburn, zinc oxide. But as far as actually helping itching, that's not something I've seen in the research or personally tried. This is all oral. So as a cause, one thing we see is a decrease in cyclic AMP when people have pruritus. And so this is an important thing to kind of bridge our conversation a little earlier about licorice, is that licorice is going to also lower cyclic AMP. So if we're going to give licorice for somebody with throat pain, we want to make sure that they don't have a pruritus. They don't have pruritus as a symptom. And so then we have to look at, well, what's going to increase cyclic AMP? And all of these things will. Burdock is a root. Flavonoids are components found in a lot of orange and red and purple foods. Jujube is a date. And then we have a couple oils. EPO is evening primrose oil. And then we also learned that exercise increases cyclic AMP. So, it's definitely possible that if pruritus comes and is caused by this mechanism, exercise could help. So fatigue. So fatigue is, of course, something that we see, all across the board. At least I do in my practice. And certainly can be related to chemotherapy. It certainly can be related to the side effects of drugs, and certainly can be just related to life. And so much of fatigue I see as a stress-related component, having a stress-related component. And to me, that brings me back to the adrenal glands. And the adrenal glands are, in a certain way, I feel like a hot topic in medicine, and then also a under-talked about topic in medicine. And it's really, really important that, one, we begin with testing for the adrenal glands if we are suspecting something like fatigue, testing for adrenal gland function. And how would we do this? The gold standard in the industry for adrenal gland testing is through saliva. And so what we're looking at is we're actually looking at a cortisol output, cortisol times 4. We're looking at saying, not just looking at the ACTH, not just doing a dexamethasone test, but looking and saying, if I take cortisol 4 times throughout the day through a salivary sample, what is happening at any point throughout the day? Because I can take somebody's cortisol or ACTH at 2 in the afternoon and find that they're fine, but find that at 8 in the morning when they're supposed to be, their cortisol levels are supposed to be rising, they have a cortisol level of 1. And so this really gives us a huge amount of information. And the other thing that the adrenal glands put out is DHEA. DHEA, if you guys recall from physiology, from biochemistry, is the precursor to our sex hormones like estrogen and testosterone. And DHEA is going to keep cortisol in balance. So basically, if DHEA is going down, usually we see cortisol go up. They have a very inverse relationship. So it's really, really important when we are working with the adrenal glands and fatigue, we're seeing, one, what is happening here to both the cortisol levels and to the DHEA. And then we're also seeing at what times of the day are these imbalances occurring. Because if somebody's having a hard time waking out of bed because of low cortisol level, that's when I want to support them and support their adrenal glands to get more cortisol in them. I don't want to do it at 2 in the afternoon when their cortisol level is fine, because all of a sudden if I overstimulate them at 2, I'm going to possibly, send them into having a lot of anxiety, for example. So this is definitely an area where a really, really superior, really well-developed test is very important, because it's really going to help us catch things that might not have been caught otherwise. And it's also going to help us dose and treat this condition a lot more, a lot better. So then how do we treat this? So adrenal glandulars are simply glands of other animals, and so this is also an area where we have to use really, really high quality products to make sure that, of course, these animals have been well tested for diseases and that they're clean products. So an area that is important, that we know the companies, we know the research, we know what they're looking at. Vitamin C. So study looking at ascorbic acid and mice is basically showing us that mice, basically, if they die shortly after birth, they have lower levels of catecholamines and also lower levels of ascorbic acid. So, the extrapolation from these researchers was that possibly ascorbic acid is needed to help with the adrenal, with the formation of the catecholamines, the epi, the norepinephrine in the glands. But certainly, if we look at how the enzyme that makes adrenals work, that makes us to say, produce cortisol, that enzyme needs vitamin C in order for that enzyme to work. And so from that perspective, we absolutely know that vitamin C is necessary here. And again, the dosing is going to be, just like in pharmaceutical medicine, the dosing is, of course, going to be so dependent on the condition, on the person, these sorts of things. And then zinc and B5 are also needed to make cortisol. Other things found in the adrenal gland are superoxide dismutase and glutathione. So it can be very important in the production of cortisol, but it's very important we don't use these two things, especially when we're doing something like chemotherapy, because these two things will absolutely upregulate liver pathways. So we will detox quite a bit faster when we do have these things in our body. So we either need to have had somebody on these things for a long time prior to chemo so we know how they're responding, or wait until something like chemo is done so we can watch certain levels and know if people need to have their medications altered in any sort of way. So we're pretty much out of time. There's a few minutes left for questions. I'm sorry I didn't get through everything, but I could talk to you guys all day. Are there any questions I can answer for you? Yes?
How are your services handled by insurance, and especially by Medicare and Medicaid, or by all insurance?
So the question is insurance, and how are my services handled? And really, most insurances, unfortunately, are not on board 100%, where I run a cash-based practice, so everybody sees me, it does pay out of pocket, but what I do find is that quite a few people do have out-of-network coverage for holistic care providers. And so I do have some people that I give them super bills for, and they are able to get reimbursed by their insurance company. So that does exist. It's definitely something that people need to check with their insurance providers in order to know for sure. But definitely we're moving more into that direction. It can be a little bit more common for acupuncturists for that. The other thing that's very helpful for people paying cash base is that FSA, MSA, and HSA do accept my services. So, and that seems to be pretty much across the board that I can get
Do you know
people that.
about Medicare and Medicaid?
I don't know about Medicare, but Medicaid has not been very friendly to me as far as allowing me to treat people in the state of Colorado. So, and it's been probably 6 or 8 months since I looked at that, but I was denied to be able to work with them about that time ago. So that's where we are. Any other questions that I can answer for you guys? I really appreciate you coming. Please don't hesitate to ask if you have any questions. Thank you.